Today we are going to be discussing the topic of fluoride. Fluoride treatments are offered at all cleaning appointments: the adult prophy, the child prophy, and periodontal maintenance. How does fluoride strengthen your teeth? When it reaches your teeth, fluoride is absorbed into the enamel. It helps to repair the enamel by replenishing the lost calcium and phosphorus to keep your teeth hard. This process is called remineralization. When fluoride is present during remineralization, the minerals deposited into the tooth enamel help strengthen your teeth and prevent dissolution during the next demineralization phase. Thus, fluoride helps stop the decay process and prevent tooth decay. So who does it benefit? The fact, 43 of the 50 largest U.S. cities add fluoride to their public water supplies to help reduce tooth decay. A person can find out if his or her water is fluoridated by calling the local water district or by having the water analyzed if it comes from a private well. So it does benefit people who drink from a water supply with little or no fluoride. Maybe people who drink mainly bottled water. And the big ones, people who have dry mouth, recession, orthodontics, sensitivity, history of radiation therapy to head or neck, a high caries rate, or localized or generalized demineralization. How do you present the adult fluoride? Here's a couple examples of how to properly verbalize to a patient. Bill, something I would like to strongly suggest for you is receiving a fluoride treatment. It helps prevent cavities and has many other benefits. It's a great way to help prevent future issues, and I really feel it would benefit you, especially in these areas. And that would be a great time for you to use the mirror or intraoral pictures or whatever you might need and point those areas out. Show them where that demineralization is occurring, where it would help the margins around those crowns. Show the areas so the patient knows. Then we also want to be sure to tell Bill, some insurance companies do not cover this benefit for adults. And even if yours doesn't, we feel so strongly about it that we charge a low fee of only $25, making it affordable to our patients. We want to make them aware of that adult fluoride fee, the low fee of $25. Insurance typically does not cover for adults. However, there are some that do. It is our job to let the patient know if it is a covered benefit based upon the benefit breakdown we receive from their insurance. For example, some cover it 1 time per year, some cover it 2 times per year. Some have an age limit associated, maybe 22 and under or 18 and under. Do your research and find out what that patient's insurance will cover so that when you're presenting it to them, you can let them know. Child fluoride fees. Insurance typically does cover child fluoride, but if it doesn't, our fee is $43. We want to make sure that the patient and their parent are aware of that. Make sure parental consent is given before applying the fluoride. Discuss the benefits with the parent or guardian. What we use mainly amongst our offices is Fluoride Varnish. It has 22,600 parts per million. It is the highest in concentration and most effective amongst all forms of fluoride. And this is why we use it. High concentration fluoride varnish is painted on by a dental or healthcare professional. It is painted on directly onto the teeth. Fluoride varnish is not intended to adhere permanently. This method holds a high concentration of fluoride in a small amount of material in close contact with the teeth for many hours. Varnishes must be reapplied at regular intervals, with at least 2 applications per year required for effectiveness. Again, it must be delivered by a dentist or qualified professional. Is there an age limit for children? No, there is no age limit with fluoride varnish. Fluoride varnish is recommended for children of all ages, including infants. Fluoride varnish can be used on babies from the time they have their first teeth, and we usually just put a small amount of fluoride varnish on those teeth that are erupted. Here are simple 5 steps to applying the fluoride varnish. Discuss the benefits with your patient. Make sure you're prepared to apply that varnish. Get all the necessary tools that you'll need, for example, the fluoride varnish, maybe some gauze squares, your non-latex gloves. Next, we want to dry the teeth thoroughly. Apply fluoride varnish, and then discuss post-op instructions based on manufacturer recommendations, based on the brand of fluoride you're using. A quick review. We have it all set up, we're ready to apply, and then you clean up. Biggest thing I want you to remember is we want to make sure your tooth surface is as dry as you can possibly achieve when applying this fluoride varnish. We want that varnish to sit on the teeth, adhere, and absorb, and in order to do that, we need to get that tooth structure as dry as possible. Use your gauze you have available and an air combination.